Non-pharmacological management of delirium requires a multidisciplinary approach to patient care. Specific interventions include reorientation, family participation, early mobility, hydration, sleep hygiene, and reducing environmental stimuli, as well as being alert to pain and constipation. Patients experiencing delirium can be disorientated and confused. Thus, having effective verbal and non-verbal communication and interpersonal skills will help alleviate the patient's anxiety and fears. Specifically, healthcare professionals should introduce themselves to the patient, orientate the patient to time, place, and person, explain what is happening and why. The patient's short-term memory may be impaired as a result of the delirium. Therefore, it's important to repeat information as and when necessary. Patient agitation and responsive behaviours can arise as a consequence of the delirium. Understanding, empathy, and reassurance are essential responses to these. Involving and liaising with family members to support and reorientate the patient during this time is important. Delirium adversely affects the patient's sleep-wake cycle, which contributes to patient fatigue, disorientation, and confusion. Sleep hygiene can be promoted in a number of ways. It is important that environmental stimuli are reduced to enable the patient to rest and not to become overstimulated, as this will exacerbate the situation. Therefore, excessive noise and harsh lighting needs to be reduced. These actions, along with active promotion of quiet times, especially at night and at specific times during the day, will also promote sleep. Designated patient rest periods where there is reduced activity and reduced visitors will facilitate patient rest and sleep. Being alert to pain and discomfort is important, as these factors can aggravate the patient's experience of delirium. Assessment and management of these factors may include non-pharmacological measures such as positioning, checking for and alleviating thirst or hunger. Checking oxygen saturations and bloods are important, as these may require management. Dehydration can exacerbate delirium, therefore the patient's hydration and nutritional needs should be assessed and attended to. Depending on specific individual requirements and contraindications, these may be provided orally, intrally, or parenterally. A contributing factor to delirium is constipation. This needs to be assessed for and managed accordingly. Appropriate hydration and, where possible, mobilization will also help this. Early mobility is also recommended, both as a preventative measure and as a way of reducing delirium.